Thank you, Travis. Good evening, viewers, and welcome to tonight's regional news. We begin in Trinidad and Tobago. The Prime Minister of Trinidad and Tobago says he is worried that the island country has recorded its first case of the United Kingdom COVID-19 variant. In a statement on Thursday, the Ministry of Health advised that Trinidad and Tobago recorded its first such case. It is said that the patient traveled from the United Kingdom. The ministry said that the presence of the variant was confirmed via a gene sequencing study of the Faculty of Medical Science, UWI, which has been testing COVID-19 positive samples collected since September 2020. The patient provided a negative PCR test, which was taken 72 hours before leaving the United Kingdom under quarantine protocols. The ministry said the patient was immediately put in a single room in a state quarantine on arriving in Trinidad and Tobago. It said once the positive COVID-19 result was confirmed, the patient was transferred directly to an isolation area at the Cuba Hospital and multi-training facility. The ministry said the government will continue its 14-day state quarantine for returning nationals from the United Kingdom, and those from all other high-risk countries will be subject to 7 days state quarantine and 7 days home quarantine. Meanwhile, Martinique health officials also suspect that a resident may have contracted a variant of the COVID-19 virus. As a result, they are investigating the case. The regional health agency reported that the man traveled during the holiday season. When he returned, he had symptoms which suggested he had COVID-19. When health officials administered the RT-PCR test, it was positive and showed a mutation of the S protein of the virus, the health agency press release disclosed. It is said sequencing is underway at the National Reference Center for Viruses and Respiratory Infections in Lyon, France for confirmation. Martinique health officials are conducting contact tracing and have so far isolated 8 individuals. Now for some news out of Barbados. With calls in some quarters for the Barbados government to halt the entry of visitors to control surging COVID-19 cases, Prime Minister Mia Mottley has indicated it would take more than that for her administration to stop tourists from coming at this time. Speaking at a virtual press conference on Thursday, Prime Minister Mottley listed a number of other events that would have to happen to force government's hand to shut down commercial air and sea travel again after welcoming back tourists in July last year. For one thing, she said, health authorities would have to advise her to once more stop visitors. Additionally, she said, and I quote, "The recommendations from the public health officials and the determination that we can do nothing more to protect persons who are not working and nothing more to protect persons who are suffering would be critical factors," end of quote, the Prime Minister declared. And now for some more news. The United States top medical officials said on Thursday that the United States will now join the World Health Organization, WHO, global initiative to help poorer nations overcome COVID-19. Washington also outlined a raft of new measures in support of access to universal health care, such as abortion services. Addressing the WHO's executive board meeting, Dr. Anthony Fauci, chief medical advisor to the new U.S. president, said that President Biden intended to issue a directive within hours so that the country can become a part of the COVAX platform to advance. Addressing the WHO executive, Dr. Fauci also announced U.S. plans to work with other countries, and I quote, "to counter the erosion of major gains in global health," end of quote, specifying HIV/AIDS, food security, malaria, and epidemic preparedness. I quote, "It will be our policy to support women and girls' sexual and reproductive health and reproductive rights in the United States as well as globally," end of quote, the U.S. official added. And that is all for your regional news. Thank you for joining. Back to you, Travis.